Thank you so much for being here today for our May office hour. Today, we're going to talk about professional responsibilities, cultural congruence. My name's Dana Asby. I'm a project specialist for the National Family Support Technical Assistance Center, and we're here today with Tavo Sastre. He's the executive director for Reach Family Services, and he's going to tell us a lot about cultural congruence today. But before we get started, let's do a little bit of housekeeping. First, I need to tell you that this webinar is sponsored by the Substance Abuse and Mental Health Services Administration. The views expressed in today's presentation do not necessarily reflect the official views of SAMHSA or the Health and Human Services. We are very grateful to SAMHSA for their support with our 5-year grant. And at the end of today's presentation, we will be asking you to take a brief survey so we can show SAMHSA that these type of events are very important and continue to be able to provide them for free to you all. We're also always grateful to our PI, Dr. Linda Gargan, the Executive Director of the National Federation of Families, for her support as well. During today's presentation, if you could please keep your microphone on mute so that we can hear Tavo's excellent presentation, that would be great. During the Q&A part of our session today, you can raise your hand to unmute and ask your question live. You can also type any questions that you have for Tavo in the chat throughout the presentation. We'll probably save those towards the end for the Q&A, but we'll keep note of them. You can also raise your hand if you need any technical assistance or send a private message to one of our staff members, Lachelle Freeman or Gina Fitzgerald, and they can help you out. Today's session is being recorded, and we will be putting that video up on our YouTube page in at least within 2 weeks of the presentation. You'll also receive a follow-up email with that recording and the slides today, as well as any resources shared in the chat. Please do feel free to put any resources or comments or questions in that chat the whole time. We do not offer CEUs for these presentations. However, you will get a certificate of participation if you take the feedback survey at the end of today's presentation. So a link will appear when you close this meeting and you take that survey, and at the very end of that survey, you'll get a link to the participation certificate, and you download that, and then you fill in your own name. If you have any questions about that, you can always email us. My email is right there on the screen, and will also be at the end of today's presentation and in the slides you'll receive when you get the follow-up email. Before we begin, I briefly want to tell you a little bit about the National Family Support Technical Assistance Center. We do provide technical assistance and training to anyone in the family peer workforce. We create resources that provide information about evidence-based and community best practices. We do trainings like this one and our other events. Sorry about that. We also create resources for the family peer workforce, families, and providers. We do workforce development activities, including research projects and trainings like this, and we provide one-on-one technical assistance. Not everyone's familiar with what technical assistance is. Basically, any organization or professional who works in a system that serves parents, caregivers, and families can reach out to us and ask us questions that will bring them connections to other organizations or systems, help them with specific strategies to reach partner organizations and family members, explore resources or share resources that we have. We can also help you with your certification program development, and we can help your organization with strategies to help sustain and grow the family peer workforce. In today's presentation, our presenters and we request from the audience that we all use family-driven language. We want to make sure that when we're sharing in the chat or during the Q&A portion and the breakout rooms, that we think about the words we're choosing and make them trauma responsive, strengths-based, avoiding blaming caregivers, inclusive, person first, respectful, non-judgmental, and that the language we use is then consistent with our actions when we go back out into the field. Let's get to our series today. We're really excited that this is the second to last of this year's office hours series. We're trying to prepare the family workforce for systems transformation and authentic family partnership in this series. Our goals in these sessions together are to support family peers to build skills around the 5 core competencies. We also hope to inspire family peers to challenge systems through advocacy. And we hope that you leave today's session with some resources, tools, and that the breakout rooms are an opportunity for co-learning. We have some recordings on the NAFSTAC event page and the NFF YouTube page that are the first sessions that we had. We had a great one on wellness and resiliency in December with Wanda Douglas. There's one on affecting change with Barbara Callahan in January. In February, some folks from My Kid joined us for resources and natural supports. We had a session in March and April around systems knowledge and navigation with a plethora of wonderful speakers. Gail spoke to us about peer drift in April, and now in May, we're starting the first of 2 sessions on professional responsibilities. And that's broken down into today's session around cultural congruency. And then next month, our very last session will be about confidence, boundaries, and ethics. So join us for that great talk as well. At the end of today's office hour, we hope that you will be able to understand how using cultural congruence in family peer support work increases acceptance of mental health and substance use challenges. We also hope that you'll leave understanding the importance of cultural congruency as it relates to social justice. Again, we hope you'll gain some tools and strategies to practice cultural congruence, and then learn what it looks like for families with loved ones of different ages. So let's start out with a Mentimeter poll. We're curious what cultural congruence means to you. What does cultural congruence mean to you? And Gina is putting the Mentimeter in the chat. And I am having trouble getting the Mentimeter to show up. 1 second. There we go. All right, so go ahead and type in to that Menti what cultural congruency means to you. And if I don't know is what comes to mind, that's totally fine. I don't know is acceptable. Not sure. That's why you're here, to learn about it. Another not sure. That's great. Thank you for being brave and letting us know that this is a new topic for you. Understanding cultures different from mine and approaching families with their culture in mind. Showing respect to all. Being aware of my language, being open to other cultures, being aware of others' cultures. Knowing about and practicing being culturally competent. These are all such great responses. Keep adding those to the poll or put it in the chat. We've got another being aware of culture, I don't know, inclusion and acceptance. Keep going with adding to this great bulletin board, and we'll share the responses in the slides. But now I'd love to pass it over to our fabulous speaker, Tavo. As you can see, he has a very illustrious resume here. He was born in Mexico City, Mexico. He came here 27 years ago and has worked for several nonprofit organizations. He has extensive experience presenting at conferences at various levels for over 20 years. And we really hope you can join us at our national annual conference for the National Federation of Families in November in Orlando, because we have a feeling Tavo might be there, and it's always great to see him present live in person. He has so much energy. But we're really excited that he's here today with us to share what he knows about cultural congruence. And with that, Tavo, I'd love to pass it on.
Okay, good afternoon, everybody. Tavo Sastre here in Phoenix, Arizona. I know that my background looked like that I'm in Hawaii, but I'm in Phoenix, Arizona. I'm the CEO of Rich Family Services. It's a nonprofit family-run agency that I started 9 years ago. And I'm very honored to be invited today. I do believe that I'm not an expert in this topic, because only a few months ago that I get invited, I asked myself, what is cultural congruency? I practiced this for the last 2 weeks, and I don't know if I said it correctly. Congruency, I think that is right. And when I said cultural congruency, thank you, Dana. I said, what is that? I didn't know what is cultural congruency, and I didn't know that I've been practicing this cultural congruency with the family that we serve for the last 9 years. Something that I didn't know that exists. But for me, and as you see in the slide, is respecting and meeting the cultural context of the family that we serve without judgment. I really like that word, not judgment. And to practice our beliefs. I saw somebody put in the chat, and they said acceptance. And that's exactly what for me is cultural congruence. To accept that other people is different than us, and it's okay. It's okay that we are different culture, that we have different beliefs, that we have a different backgrounds. But the importance of the cultural congruency is that we meet the families where they are, that we are committed to see what are their needs, but we need to know what is their cultural background, because we know that is more effective. And we're going to see in the next slides how the families can be connected with our family support partner services, with our peer services in the next level when we implement this cultural congruency. So it's just to support them in wherever they are. And I think that is fantastic. So the next slide, thank you, is meet the families where they are. It's not about where we are or what is our agenda, or what do we want, or what is the best for them. Because some of us, we forgot it and we said, I know what is the best for the family. Okay, is it where they are, or is what is in your agenda? So we need to be really careful that meet the families where they are. Not what Tavo is what they are. And in order to meet them where they are, we need to listen. We need to listen. Some of us, we tell them, this is what we're going to do in the services. This is the way that we're going to support the family, but maybe they're not there yet. So we need to really listen. What are their needs? That's part of the cultural congruency, to really understand what do they need. Also, I think that it's important that in order to listen, we have to communicate it. And the communication is going to come with question, but something that is key, and I wrote a little note here, is to share our own experience. I'm going to repeat what I said. One of the keys to really communicate and to really listen to our families and to meet them where they are is by sharing our own experience. When you share your own experience, you're going to open up the communication that they're going to feel comfortable to start sharing with you. A lot of the families that we serve, they're not there yet, but they need a little push. That push is when I said, let me tell you a little bit about me. Let me tell you a little bit about my background. When I recognize to people immediately, and always I share that in the national conference, always I said, English is not my first language. Everybody noticed that. I'm from Mexico. My first language is Spanish. At 21, I came to US and I didn't speak English. So I need to be honest and transparent with people. And I said, if I don't understand something, please let me know, so that you completely be yourself and communicate with them to understand their specific goals. What is what they want? It's extremely important in cultural congruency. What are their specific goals? Sometimes we visit families, or our staff visit families, and they already know this is what I'm going to do with the family. Is that their goal? Is that what they want? Is that what they sign up to get a provider? It doesn't matter about our experience. I got a staff member that just complete a whole nutrition, healthy lifestyle eating. Now she wanted everybody eat vegetable and fruit. Some of us, that's not our goal. That's not my goal. I want to continue eating Mexican burrito with some guacamole, and that's not my goal. You cannot just come and tell me that I need to lose weight, that I need to eat healthy. Maybe that will help. My wife will be really happy if I do that. But if it's not my goal, we need to understand what is the goal of the family that we serve. So not because the kids, they have a specific needs or a diagnosis that we are familiar, we know what do they want. That doesn't mean that we know what are the specific goals. So we need to connect with them. We need to be committed with them. We need to know this is not part of my agenda, but cultural congruency tell me that I'm going to accept you, that I'm different than you, and it's okay. But I'm still committed to make a difference in your life. Next slide, please. Thank you. How can you show cultural congruency? Many ways. This slide could take many, many minutes because we start with the language. And it's important for Rich Family Services. We have 24 employees, and 20 of us, we are bilingual because the population that we serve in Phoenix, Arizona need a lot of Spanish-speaking services. And that was also make us very unique here in the Valley. But the language is extremely important. I try to see what is the background. We have especially a person in intakes. And when the family, they don't speak English, I cannot give a family support partner if they're not bilingual. I need to really meet their language to understand the disabilities. Again, not because what the book said, but to talk to the family to know really what are the disabilities and that we have the right staff to provide those services. To understand the heritage, I think that is correct, heritage, I don't know. But that means your culture, their culture, their traditions, their values, their celebrations. If we understand it, we're gonna provide more effective services and we're gonna really get the goals that they wanted when it's that connection with the family. So I told my staff, my 24 staff members, I told them, we really need to listen and learn from the families, who they are, what do they like, and to respect that they have their own values, their own traditions, as simple of take a shoe indoor, wash your hands. And I put this specific because I remember a long time ago when I used to do services before I do my role as a CEO. But I remember that when I visit a family, the mom always yelled. And she said, when the kids get to the school, sometimes I arrive before the kids get to school. And she said, everybody wash your hands and remove your shoes. And what I did is, as soon as I get in the house, I wash my hands and remove my shoes. It's part of what their tradition, it's part of the culture. I cannot say, no, I'm different. You know, I don't get paid for that. I need to respect and listen. I need to listen what is the food that they do. I got a mentor, an FSP that told me, hey, Tabo, I got a family that every time that I get there, they offer me food. Accept it. If you're hungry, you can eat. Can I eat? Absolutely, yes. That is a connection in the next level with cultural congruency. Absolutely, you can eat. I remember that family say, Tabo, you want coffee? I get when I used to do services, they said coffee with vanilla cream and no sugar. Absolutely, they know what coffee I want. And the families, they feel really connected with me because I was very committed to respect their culture, the tradition. If they have music, sometimes they have music that maybe I don't like. Maybe we have some music that is not what I'm used to, but at the end of the day is meeting where they are. So now if the music, of course, is a distraction, if they have a heavy metal concert when you are your services, you can be very respectful and request, can we remove the music? That's fair. But if they have a music that doesn't bother you, but you don't like it or you don't understand it, ask them what is that about. Ask them why they like that music. Not only accept the music, but ask them, and maybe they tell you, well, my parents, they used to listen to that music when I was a kid. And then maybe your culture is different, your music is different, but you said, wow, for me, my dad used to put this music, or my mom used to, and then you share the music. That is the connection that I do believe that providers and the family, not everybody has. A lot of people, a lot of services, we just get here, I do your services, what are your needs, and goodbye. It's not a bad thing. Cultural congruency is bigger than that. Cultural congruency is the connection with those families. Can we put the next slide, please? Benefits, and I saw really quick, I know that they're gonna put in the chat, so feel free to put any comment in the chat. I cannot see the chat and see the screen. I'm gonna multitask. That's who I am. It's part of my tradition. When I watch soccer, I just can watch soccer. My kids cannot talk, my wife cannot talk, I just watch soccer. My wife is the opposite. She can get in the phone, she can cook, she can talk to the kids, she can do homework at the same time, but that is another presentation. But please feel free to put any question in the chat, and we're going to address them before we finish the presentation. The benefit of the cultural congruency is the connection that I was talking about, that the family feel, oh wow, he or she wants to know who I am. Of course, now if you know that level of connection, is going to be easier that they tell you about the trauma, about the tough moments that they have in their life, about the kids, about whatever is happening. They're gonna feel more comfortable to talk to you because now is that connection. But that connection will not come if you are not committed to be and understand their culture, to have that desire to say, I can be different than you and it's okay. I don't need to be like you. You don't have to be like me, but I'm gonna understand that we are different. And I'm gonna be committed to learn about you, that I can provide better services for you and your family. And it's how we do that connection with effective communication. Not to have your own agenda, to have that open communication. Always I tell my staff members, see the goals of the family, see their needs, and make sure that you cover that in your second or your third services. And they say, what about the first one? Connect with the family. First services, connect with their family. Share who you are. Tell them about you, about your life, about your challenge. Ask them respectfully if they want to share with you about their background. You can ask that, and you can ask a simple question as, may I ask you, about you, where you were born? Tell me, would you okay to share about your family? Let me tell you about my family. And then you open up, and they're going to start feeling, and you're going to start building the trust, which is the next bullet point in our slide. That trust, you cannot get it in one day. That trust cannot happen over 24 hours. That trust is like any other relationship. You need to work that people, they said, I really trust my family support partner. I really trust my mentor. I work with my mentors, and we said, when you work with our youth, I tell them, listen to their music. And then we said, be careful, because the music that you're listening, it will not give you nothing good in life. Let's study the lyrics. Let's see what does that mean. And instead of change that music, I don't like, that's an ugly music. We tell the mentors, listen to the music that you can say, wow, that's pretty good. That is really nice music. Who told you about that music? Oh, really? Let me tell you what I really like. and then you share that if it's appropriate. The empathy and the compassion. The empathy and the compassion is something that I told all my staff. You can have it or you don't. It's something that you cannot fake it. It's like passion, compassion, empathy. You cannot just, I'm going to be in my services, I'm going to fake it. I'm going to show something that I don't have. Either you have it or not. And that's the question that I ask my staff member. Either you have it or not. Are you committed to make a difference in these family lives? Are you committed to empower this young person? If the answer is no, maybe we are in the wrong business. All of us, we struggle, and because we are in a very challenged field. Our job is not an easy job, but we really need to work with these families to really understand that we can make a difference if we just understand where they're coming from. Can we get the next slide, please?
That was
Oh,
it. Any closing
yes. So
ideas?
what is that? I would like just to share. I wrote a little note here, and I said I think that we really need to listen to the people. When I got people that they say, Tabo, I don't speak the language, or I'm very different. So I want just to say maybe we have different situations, but maybe we can get connected with the emotions and the feelings. Maybe we are different situations, but maybe we can connect with what is happening. I got somebody that they don't speak Spanish, and they said, oh, I'm really, busy all the time. I'm from New York, and in New York, you don't stop. I'm bam, 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 and chop, chop, and time is money. And I said, oh, really? I feel kind of, identify with you. I'm from Mexico City. It's the second largest city in the world. And we talk about the traffic, and we talk about so many people walking, and nobody say hi. So it's important that you understand that it doesn't matter that I don't speak Spanish. It doesn't matter that I'm not Mexican, or I'm not from China, or I'm not from Paris, or whatever you're from. It doesn't matter. You can find certain aspects in life that you can get connected. Always I told the family, maybe I have not going through what you're going through, but I can see that you have fear. So let me tell you what I did. How do I handle fear? And then I give the example. When I come to US without speaking English, and then I didn't have no family, and I didn't have no job, and no house, and no money. So I was really afraid. Let me tell you, how do I handle my emotions? So I don't have to go through your same thing, but my emotion can be connected with you.
Mhm.
When they talk about the divorce, I said, I got it. I know you're going through a difficult situation. When they challenge their kids, I have no how maybe those challenges with my kids, but maybe I have those challenges when I was a kid, or maybe somebody close to me. Be committed to connect with those families. That cultural congruency is to meet them where they are, and that you have empathy and love for the families that we serve. Thank you, Dana.
Thank you so much, Tavo. That was wonderful. I really loved what you said at the end there too about how we can find something to connect us always. Really great presentation. I can't wait to hear the questions folks have for you. But before we have our Q&A session, we are going to go into breakout rooms in just a moment. We'd love to review our community comfort agreements first. A reminder that we use person-centered, family-driven language. If you can think back to that slide at the top of today's time together. So while you're in there, we know that the first question is about challenges, and we absolutely want you to talk about your challenges, but we want to leave our breakout rooms with some focus on strengths, solutions, and future opportunities, and minimize anything that becomes venting. We also want to make space for all of the voices. There are 48 of us here, and we're going into 3 breakout rooms. So there are going to be a lot of folks in those breakout rooms. So we like to use the 3 and then me philosophy. So if you shared something, if there are others in the room who want to share, if you could let 3 other people share before contributing again. Finally, if you are lucky enough to get into the room with Tavo and you have some questions for him, we'd really love it if you could save them for the Q&A portion of our session today so that everyone gets to learn from Tavo's wisdom and try to stay focused on the breakout room questions during the next 20 minutes. So there'll be two questions that you and your team are going to discuss. The first one, what challenges related to culture have you encountered as a family peer? And as you share those challenges, you can share how you overcame them. Or if you have not overcome that challenge yet, you can solicit some advice from the folks in the room of what ideas other folks have or how they've overcome similar challenges. So we'll be in our breakout rooms for 20 minutes, and you can always come into the main room if you're having any technical difficulties, and I will help you out. So Lachelle, if you could launch those breakout rooms. I hope you had some great discussions in your breakout rooms, and hopefully you can share something new that you learned either from Tavo or in your breakout room about how you might practice cultural congruence in your work. This is a great place to share out some of those great strategies and practices that you learned about today. Be aware of what I hear or see. Right. The Mentimeter chat is in, the link is in the chat if you want that. Listen more and be curious. Yes, I keyed into that too. Tavo kept talking about the importance of listening. Sometimes it's not as important to try to know everything, but just be curious, listen, and ask questions like someone just said. Wonderful. Self-care. Yeah, that's very important. Practicing it and sharing about it. Understand that it's not our agenda. It's about the family's goals. Yes. Have the courage to be okay with not having all the answers. Absolutely. Ask questions. Show appreciation for what the family's sharing with you. Be curious. Share more to connect better. Allow myself to be open to new experiences. Yes, absolutely. Excellent. All right. Well, now is one of my favorite parts of our time together. And you can keep adding to that, and we'll share those with the slides. But now is when you all get to ask questions and hear the answers that Tavo and your peers have. So while you all are raising your hands or putting a question in the chat, we did get some pretty good ones in registration. So I can start us off with one question from registration. Some of our organization's peers struggle with knowing how to approach asking or collecting demographic information from families they serve with regard to race and ethnicity. Tavo, do you have any suggestions on how to do that?
Yes, we share in the small group. It seemed like a lot of people will struggle with that. I was sharing in the group that a lot of people, they don't feel comfortable at the beginning. That's why we need to earn the trust. But we have an activity that we put in a paper about let's know to each other. Let's learn about to each other. And the FSP, the family peer do it, and the mom or the participants, they do it as well. And then we tell them, anything that you want to feel comfortable, you can answer about you, your culture, your background, because we talk about religion in the group. And definitely that is a very delicate topic when we talk about if you believe in God, you don't believe in God. We need to be really careful with that because a lot of people, you know, for natural thing, they leave the house and they say, God bless you. But if they don't not believe in God, you cannot say, God bless you. So we need to be careful with that. So what we do is we pass this paper and they said, where you born? What is the language that you speak? What is the language that you feel comfortable? Because maybe I feel more comfortable in English. People, they don't know that. But they need to know what is the comfortable language that you speak. What is the language that you speak at home? Do you practice any religion? Do you spiritual? And I think that we tell the family, we are so committed that we go to the next level, let's know each other. Would you be okay to answer this? And then we pass that. A lot of people, they feel more comfortable writing it instead of talking.
Oh, that's so great. I heard some key things like actually building that rapport and having a conversation rather than just trying to collect that data. Sometimes giving them the chance to write it out can be great. And I'm also thinking about our Words Matter Wednesday series, which we have coming up tomorrow and the couple Fridays after that. That's a great place to ask these types of specific questions too, especially if you're thinking of specific populations. So we'll share that at the end of the presentation, or maybe Lachelle will pop that in the chat for us to talk more about that, because that's a topic of conversation that comes up a lot in research, is how to approach that sensitive topic with delicacy and respect. All right, any questions, raise your hands or pop it in the chat. If not, I've got some more from registration. All right, this one's a long question, but stay with me. I'm gonna I might repeat a couple of parts at the very end. So I have difficulty helping the students that I work with who and their families who are Hispanic navigate the tension between personal success and duty to family. Do you have any suggestions for how I can honor the love of family and help them realize that changing some actions would help them to be more economically successful and benefit the family? For example, I had a young man that was super intelligent. However, his mother had multiple doctor visits. He missed so many classes that he ended up not doing well in school because he didn't trust interpreters to help his mom. He insisted on being right by her side. It was super sweet and admirable, but he had so much undiscovered potential. So that question is, what are your suggestions for how to honor the love of family and help them realize some changes that would help them be more successful?
What a great question. What a great question. And I leave a little bit of that question in my personal life. So what I would like to say is a lot of the people, they do what they do because they don't know anything else. They just don't know nothing different than what they do. So for the parents says, my kids help me to go to the doctor and to translate, that is such a good thing. So number one is that we acknowledge that that is fantastic what the son is doing. And instead of that's bad, you're irresponsible, you're missing the school, it's not a bad thing. It's to acknowledge the love that he got for his mom. It's fantastic. However, I think that one of the things that the family have not seen is what are the other things that are possible in the kid's life. Will be possible that your kid, they graduate high school, go to college, become a doctor or a lawyer or a teacher. If the answer is yes, the family, they don't know, and we say, do you know how much missing school can affect that in this country? Not to make them wrong, but to see them what else it's possible to open. I think that is extremely important. And what I said that happened to me is because one of the things that I remember when I was a kid is that I used to go to vacation 3 times a year. Thank God, my mom has a vacation all the time, but that was during the school. And we miss school 3 weeks a year. And my mom just give them a present to the teacher and the teacher's day, and nothing happened. So I came to US, I get married, I got kids, and I thought that I can do the same. And my kids start missing school and go to vacation. Nothing happened. Guess what? Until I receive a letter from the school that I was doing something wrong. And I said, hold it. My daughter has A's and B's. It's nothing bad for missing couple. It is wrong. You have certain days a year. And when you pass that, I was like, qué bonito. Thank you. I didn't know that. So, but if somebody would have opened to teach me, I wouldn't do that. So today I'm only go to vacation when it's vacation time. I don't go to vacation when my kids are in the school. I plan the doctor appointments when the kids are in holidays. because I need to meet where they are. I need to learn how the system works. A lot of the families, they don't know that. With a lot of love and respect, we can tell them, may I share with you how this works here? Even for mistakes, you coming from New York to Texas to Arizona, let me tell you how California works. Maybe it's different than here. Oh, so we need to tell the families what worked, and maybe the family, they don't know that even though it's a lovely moment to translate in the doctor appointment, if the son continue missing school, he's gonna close certain doors in life. And I agree with that, but we need to be careful how do we say that.
Wow, that's a great response, Tavo. I love that you're saying that you approach this conversation with empathy and compassion and sharing your own experience to kind of make them feel comfortable and avoid that shame and blame that sometimes
Yeah,
when our cultures are just different. It's nothing bad, it's just different. That's great. I wanted to
absolutely.
out Alex's response to my previous question about organizations who are struggling to collect data about race and ethnicity in a positive way, that during his their intake process, they always start with some of these questions can be very personal and you can decline to answer, and they do not affect the services you receive. And their families tend to answer them more openly, knowing that. That is such a great tip, Alex. Thank you so much. I'm gonna try to remember to add that to the follow-up email because that's one to keep in mind. Thank you. Does anyone else want to share about the first question around collecting data, or around how to honor families, traditions, and cultures, but also help them be successful in the situations that they're in?
I don't know if others are doing this. I'm sorry. Okay, there we go. But we do a document called the Strength Needs Culture Discovery, where we go out and we ask a lot of questions. And I don't know if Alex was responding to me or who he was responding to, but in that you learn so much about the family, and it's like a story for them that we then print out for them and give it to them.
That's great. I'm just putting it in the chat. If you could share that, if you have a link to that, that would be great.
I
Or
don't have a link to it. It's just something that we have.
okay,
It's part of the high fidelity wrap around process. That's a tool that they use.
great. Thank you.
And if I can find it in some of my documents, I'll forward it to you, Dana.
Thank you.
It is a wraparound process. And
Yeah.
I can forward you what I have. I work in crisis, and we also do it in crisis too, just so that we can get to know the families, see what they need, like listen to their different, like, can we wear shoes in their house? Like
Mhm.
Tavo has said, can we not wear shoes in their house? Do we need language lines so that we can speak the correct? I heard like people saying that the kid was we like where I work, they won't let us do that. They make us call somebody from language line. So we'll call, and then we'll have the person, whatever language it is, translating.
Oh, wow.
Yeah.
And that's a great example about organizational practices that then help to perpetuate cultural congruency. Because here today, we're really focused on the family peers, what practices individuals can take, but sometimes it's an organizational cultural shift as well. So thanks for pointing that out. Again, raise your hand or put a question in the chat if you have anything to share, or want to respond to a question, ask a new question. And Lachelle has put an example of that assessment in the chat. Thank you so much, Lachelle. I will go ahead and ask another question while folks are thinking. So Tavo, one of the things you said to practice cultural congruency was understand the family's specific goals. So how can family peers navigate situations where their own personal cultural beliefs don't really align with the family that they're supporting? What advice would you give?
That's a tough one. That's a tough one. I asked a question to my staff member when they told me that, I'm not aligned with what they said, and I understand, and I have very respectful with my team. But the question that I ask is, are we here to serve the families, or are we here to serve the staff? I don't want to sound rude, but you apply to a job to serve the families. I can serve any family that there can be different than me. Maybe they think that sports are for dumb people. The only thing that I'm going to do is to avoid to talk about sports because I love sports and I love soccer and I love football, but I'm going to avoid that conversation, but still I can impact the life if I don't see them as wrong. If somebody doesn't believe in God, I can still empower that family. I don't need to convince them of my values. I don't need to tell them that it's okay not to believe in God because I'm a spiritual person, but I'm here to put happy table or to provide the services for the family. So it's a lot of trainings, and I have this Thursday another 4 days of a staff retreat. We're gonna go to a big house, all my staff, and it's this type of conversation, and we need to acknowledge and recognize that this is not an easy job, but we are here to separate table and listen what the family need, and to invite the people to separate your personal beliefs and empower the family. This is difficult. It's not an easy. I want to be respectful, but at the end of the day, the question is, why do you work in Reach? Who are we serving?
Yeah, that's great. Does anyone else have an experience with this type of situation? If you want to share a specific experience that might help folks understand.
You know, to a follow-up with that.
Yeah.
I agree. When someone finds it challenging to engage and support a family, and when they feel that the family's lifestyle culture doesn't align with them, I get having that conversation. However, I do think that there are moments when it's okay for that individual to step away from that family's life and begin and partner with someone else, because sometimes, just sometimes, there's the potential that more harm and trauma can become, into that family's life until that individual understand that it's not about him or her. And I think that's where that leadership, that seasoned voice comes from, like Tavo, until that person is ready, being able to pour into him to understand the significance of the work versus making him stay with the family can actually cause more harm, more trauma to another individual. And I would think highly of the person if they made the choice to say, you know what, it really isn't aligning with what I think, the way I live. So, Tavo, I'm going to stay with you. I'm going to try to work it out and figure out how can I do things differently. And then, because, it's not about us at the end of the day.
Mm-hmm.
I love it. I love it, and I completely agree. I think that is case by case. I think that we need to be careful if it's something that is required, and we empower our staff if they can switch how their approach. We have that more with parents. We have that a lot with the young people. We provide mentoring. So all the kids, they have a mentor, and it's common in teenagers to say, I want to change a mentor. I don't want this one, I want to that one. They look for the cool mentor, or the one that they have a nice car, or the one that is, that they like them. But we work with the teenagers and tell them, what do we want that they work more than spending time and having fun? Is this mentor is going to support you in the goals that you sign up in our program? Is this mentor is going to work? And sometimes, yes, like Tika said, I agree that maybe we then need to consider to change a staff member, but I think that as a professional, we need to consider to switch our approach and to be committed with the family, especially agencies like Reach, that we start only 9 years ago, that we start only 3 FSP services, and we have only 2 available, and only 1 is bilingual. So we have a lot. So we would just work with the staff to train them and empower them. Today, we're growing in 24 employees. but a small agency, they don't have the capacity sometimes to just give them and switch and rematch. I think that is better. I think that also is a possibility to keep the matches and to see what can they work together. It's like any other relationship. Any relationship is easy in life. It's like a marriage. Nothing is easy. We need to sit down, we need to talk, we need to be committed, and we need to see what works in our relationship.
Yeah, great points from both of you. I think the important point to take away is that each situation is individual, just like each family is individual. Each relationship between a family peer and a family is unique. And as mental health professionals, we all just keep to check in to make sure that everybody's being supported in the best way to have a positive relationship. And Renee has had her hand up. So Renee?
Yeah, sure. This is great, and I believe in the power of training, because if I wasn't trained in this first, I wouldn't know what cultural congruence means and how to apply it. How can we model that as we work on ourselves to people if we're seeing third parties not adopting to, they haven't had the training, they don't even know what it means. For example, I hear a lot of adults speaking very uncompassionately about youth and youth culture. Back in my day, which was only like in the 90s, and I didn't do this, and I'm like, your parents spoke about you the same way you're speaking about your kid. Like, how do I say that nicely? But that's my question.
Certain things, Renee, it's certain things that just they are the way that they are. Certain things just we cannot just change. It's tough, but it's true. By the way, it's really true what you're saying, and it's very difficult when people they just don't get it. Always I tell if somebody has a side job, a part-time job in Home Depot, don't take it, it's not personal, but always I said Home Depot, you work with tools, boxes, and you will not hurt the feelings of nobody. When you work in behavioral health and social work is different. We need to really pay attention to our approach. We need to be a little bit more love, more compassionate. And I think that at the end of the day, before with the families, before with the kids, before with a co-worker, I think that we just need to start with ourselves. I think that with all of us, we start loving and respecting and accepting ourselves, we're going to be able to make a difference in other people's lives. It's incredible when people say, I'm here to help you in your life, and you're the one that you are upset and you are negative and you're complaining and whining for everything. I ask my staff, how we're going to impact the life of others? I think that we just need to start with myself. Today, thanks to all of you, I'm going to love Tabo. I'm going to appreciate Tabo. And then I know that with that, I can be a better husband, a better dad, a better CEO. Let's start with ourselves. I think that that's the key of this difficult world.
Good point. Thank you.
Very good point. And that reminds me of a question I wanted to ask you, Tavo. Renee brought up the youth culture as a cultural difference, which is not something we always think about. So when we are thinking about engaging with family members of different ages, what's the best way to approach those types of cultural differences in terms of like how can someone who is a family peer and is working with a mother who might be several generations younger than them? Any tips on how to connect across the age cultural differences?
To meet where they are, to learn what they like. The people that we grow in the 70s and 80s are different than the ones that are in 2000. Our millennials, I'm different. The way that I work with people, if I work with somebody younger, I remove the tie because this tie is just different. And I'm not doing like this, and I'm gonna go like that, and I'm gonna put this on the forehead. And this is the way that I approach a teenager because they're just different. I don't need to have my tie, and I just need to meet where they are. I need to learn about their music. I need to learn about what their hobbies. They grow different the way that I grow. Maybe a mom that is 25 years old, that mom has the same challenges with their kids, but that's different the way that I grow. The 25 years old single mom has different ideas. Let's meet them where they are. Let's talk to the people that they have their age. How do you dress? How do you present? When I go to a family, I don't dress the way that I dress today. I put a Phoenix Suns or Diamondbacks jersey in sports. Or I put something that said music is love or love is music. I don't come with my logo. I don't do any of that. I need to meet them where they are because generation and age, they can be so different. And if I want to empower, train, and touch people the way that they do it in the 70s and 80s, will not work. I need to talk to my kids that are 11. What music do you like? What is the things that you guys do? What are the games that you do? And then I just need to say, when they say the same word, now with my wife, I'm playing to say jinx, because we say the same word and we need to be quiet. Jinx, jinx, double jinx. And I never do that, but I need to learn it because I do that with my kids and the families that we serve because we are committed to meet them where they are.
Great. Does anyone else have any tips for the group about how to reach family members of different ages? We do have tomorrow's Words Matter Wednesday is about the older population. So I know that's kind of a new population that family peers are starting to work with is mothers who are caregivers for their older mothers, brothers who are caregivers for their siblings late in life. So
this is Stephanie. I'm using my phone. I'm not as
yeah.
good at that as on Zoom, so I don't see my hand raised thing.
Perfect. Yes, you're perfect. Go, Stephanie.
You're good, Stephanie.
I would just add on to what Tavo said. Struggles are struggles. Caregiving is caregiving. And if we not only take people from where they are, but we show the similarities. You know, you might be 20 years younger than me, but a struggle is a struggle. And if I can show the similarities across that age divide, then I'm probably going to gain a little more trust. And I try not to think about people's ages, but I know it's very obvious that it's there at times. Because there are differences, but I think focusing in on our similarities, that we're going to move forward together with that.
Great.
Thank you, Stephanie, for your comment. Very good.
We have about 1 more minute for one more comment, or Tavo can wrap us up with some words of wisdom.
Let's show you the mute.
Thank you. I was going to say real quick, it was interesting when my son had got a youth peer, that it was a middle-aged woman. And I was like, okay. But I was really surprised. At first he was like, oh God, that's kind of weird. Probably like a couple of weeks into it, like he really like connected with her. He was like, oh gosh, she was so organized. And so it really, initially, sometimes even when you have that age difference, it's like it might be a shock to everybody. Me as a parent and working in the field was like, oh, that's interesting. But it worked out well. And it was at least a 20 to 30 year age difference. So
very cool.
My last comment today is just tie what Lachelle said. When you talk about that mentor, my oldest mentor that I got in the agency was 80 years old. He said, I want to make a difference in people's life before I get old.
Yeah, I love it.
And he became a mentor. And one of the challenges that I asked with the youth was with music. And the mentor learned about rap, and he has to listen to rap. And the young people, they need to listen to classic music and instrumental music. And they said, we're going to meet where we are because we're committed to go through this together. I think that is where I want to end this conversation, is the level of commitment what we do. It's extremely admire what all of you do for the community. either you're a caseworker, if you're a president, if you are a clinical, whatever is your position, you need to have a heart and a big one to do this type of job. So thank you so much from the bottom of my heart. It's an honor for me that the Federation invited me for this. Thank you, Dana, for thinking of me. And yes, I'll be in Orlando, Florida. This is gonna be our eighth conference in a row that we're gonna be. I'm excited. We're gonna take probably 10 or 12 young people. We need to invest in our youth. All the professional, all of us, fantastic. My mentors, fantastic. But we have to invest in our young people. So I'm gonna take 10 young people from Phoenix, Arizona. We're gonna be in Orlando, and I would love to see all of you there. God bless you all. Thank you so much for your time. Thank you for the opportunity. Thank you, Dana.
Thank you so much, Tavo. Thank you so much. I hope you are all inspired to learn more about cultural congruence and get more training on that topic. It's so, so important. And we're going to close today by reminding you that we have one more office hour next month on the second Tuesday, same time. And we're going to be hearing from Nikki Howenstein, a state recovery director, about confidentiality, boundaries, and ethics. So that registration link should be popping up in the chat for you. We also we're halfway through our SAMHSA sponsored webinar series, Person-Centered Family-Driven Mental Health and Substance Use Support, A Path Towards Equity. When you get these slides, you'll see a link to our first webinar in that series, and hopefully we'll get the recording for the second one before I send these out. And then you can go ahead and register now for our last two sessions. One's on July 9th about poverty as an equity issue for behavioral health challenges across the spectrum. And then we have another one on July 30th about the evidence base of informal and formal family peer support. So those are going to be great. Please join us for both of those. You can contact all of us at NAFSTAC if you have any questions. And if you have any questions for Tavo, he's put his email here as well. And finally, before you leave, you could pull out your phone and use that to scan the QR code, or you can just close out this meeting and it will take you directly to that feedback survey. At the end of the feedback survey will be the certificate of participation. We do not give CEU credits for these trainings, but you can download that certificate of participation and put your name in the certificate. So thank you again so much for being with us, and we will see you next month.